Hello dear students, let's start our class with a silent prayer. I hope all of you are doing great. In this class we are going to discuss the topic first aid, and in the further slides we will see the first aids for burn, nosebleed and snake bite.
In the board, you can see 4 letters. They are R-I-C-E and you may read it as rice. So my question is, do you know the full form of rice in physical education? Let's see. R stands for rest and I stands for ice packs for 15 to 20 minutes several times a day. And C stands for compression. That is compress with an elastic wrap to help control swelling. And E stands for elevation. That is elevate the angle above the heart to minimize the swelling. So this is the definition of or the full form of RISE in our physical education. Now, can you tell me the title RISE related to what? I have already told you this is related to physical education, but more specifically related to R for rest, I for ice. Then this must be related to first aid. Okay. Now, what do you mean by first aid? Or what do you know about first aid? I know some of you may know some of the first aids. And first aid is the assistance given by any person or given to any person suffering a sudden illness or injury with care provided to preserve life, prevent the condition from worsening and to promote recovery. So, this is the main purpose of first aid. Now, I have a question for you. What will you do if you see a person suffering from injury or illness? Yes, you will definitely try to help the person suffering from injury, illness, etc. and provide necessary first aid or medical attention, isn't it? So, you may have some knowledge about some of the first aids and you will apply that, and in between you will seek the help of a doctor also. Now, what are the first aids that you are familiar with? Yes, you are very familiar with the first aid for burns and wounds, etc. And are you aware of CPR? Okay, from the picture you may get an idea. And CPR stands for cardiopulmonary resuscitation. So, now can you give some benefits of learning first aid training? Some of you may know first aids of a wound and some of you may know CPR also. But others who do not know this, do you think that is it necessary to learn first aid? Or do you think that is there any benefit of learning first aids? Let's see. There are numerous benefits of learning first aids and some of them are it does more than help save lives. It enables us to increase patient comfort. It gives you tools to prevent the situation from becoming worse. It creates the confidence to care. It takes less time for recovery. So if you have enough knowledge on first aid or if you have a proper training on first aid, you can use that knowledge on emergency situation to save the life of others or to save the life of ourselves. So it is very important to know or to have some basic knowledge or basic training on first aid. And now I'm going to show you a small video. Go through the video and carefully watch it. I will ask you some questions after watching this video.
It is good if you were able to notice the color, body scales, head, or any special characteristic of the snake which bit you. But if you missed it, need not worry. Remember, don't waste time in catching or seeing the snake. It's not necessary.
Sachin, what happened?
I got bit by a snake.
The first thing that you should do after a snake bite is to immediately call for medical help. You can call for an ambulance by dialing 108 or the nearest rescue team of your region. Medical attention is always required whether the snake is venomous or not.
A snake has just bit my friend. Please come near the Kasturi Park.
The most important thing is that the victim should remain calm, relaxed, and fearless because with the increase in his heartbeat, the blood flow will increase, resulting in a rapid spread of the venom.
Don't panic, be brave. Do you know only 20% snakes in the world are venomous? And 50% chances are that a venomous snake delivers just a dry bite. Even if snake might have delivered you a venomous bite, by correct treatment and measures, you can be easily saved from any injury. So be tension free.
Then you should go to a safer place away from the snake's reach. Note, the victim should do as less movement as possible. Remove any tight-fitting clothes on or near the wound as swelling may occur. Also, remove every tight object such as rings, wristwatch, etc. Remember, don't cut the wound because it will increase the risk of infection. Don't suck the venom out as it not only removes negligible amount of venom from the body but may also poison the sucker. Also, don't eat or drink anything, especially alcohol or caffeine, as it may increase your heart rate, leading in the rapid spread of the venom. Then, if possible, arrange for a band-aid or any clean cloth available to you. Wrap it around the wound, loose enough so that it makes a finger-sized gap. Then, wrap it till the top as much as possible. Remember, don't use a tourniquet as it could potentially restrict the blood flow too much. Also, don't use ice on the wound as it can increase the damage. Then, you need to immobilize the affected body part. For this, arrange a wooden rod, stick, or a board, whatever is available to you on the spot, and place it on one side of the affected body part. To hold it, fashion a splint using a band-aid or a cloth. With this, first aid treatment gets completed. The doctor will then detect the venom and will give you the appropriate antivenom.
So what was the video about? Yes, what we must do when we have a snake bite, isn't it? So let's go through the points once again. The first aid for snake bite. First of all, note the snake appearance and convey to the doctor. Lie the person down with wound below the heart. Cover the wound with loose sterile bandage. Do not cut the wound. Do not attempt to suck out venom. Contact a health person as soon as possible. Do not apply ice or water. Keep the person calm and at rest, remaining as still as possible to keep venom from spreading. So these are the main things that you have to keep in mind when someone needs first aid for snake bite. Okay. Now carefully look at this picture and tell me what does this image indicates. Yes, it is burn. So can you give some first aid for burn? What are the first aid you know or you apply when you have burn? Okay, let's see the first aid for burn. First of all, cool the burn to help soothe the pain. Hold the burned area under cool, not cold, running water for 10 to 15 minutes or until the pain eases. So the point is very important. You have to hold the burned area under cool but not cold water. Okay, so cool running water must be used for at the burned area to reduce the pain. Next, remove the rings or other tight items from the burned area. That is also very important. Very carefully remove the rings or other ornaments. Do not break small blisters. You may have some small blisters after the burn, but do not break that. Let it be there. Then apply moisturizers or aloe vera lotion or gel. Many of you may use paste or anything like that, but don't do that. Use only moisturizers or aloe vera lotion or gel. Then check the signs of circulation. Provide CPR if needed. If the burn is according to the intensity of the burn, there are variations. If the burn is very intense, sometime you may use CPR. So at that particular situation, use CPR after checking the circulation. So I hope all of you understood the first aid for burn. Now looking at this image, can you tell me what does this indicate? Yeah, this is nosebleed. So when you face nose bleeding, what you usually do? Okay, let's see what we must do. Let's discuss the first aid for nosebleeds. First of all, sit upright and lean forward as it discourages further bleeding. As you can see in the picture, first of all, sit upright and then lean forward. Okay. Then use thumb and index finger to pinch the patient's nostrils shut. As you can see in the picture, use your thumb and index finger to gently pinch the nostrils. Okay. Tell them to breathe through mouth. As you can see, it is very difficult to breathe through the nose. So, tell them to breathe through mouth. Then, continue to pinch for 10 to 15 minutes as pinching sends pressure to the bleeding point on the nasal spectrum and often stops the flow of blood. Continuously pinch the patient's nostrils so that it helps to stop the flow of blood. So do it 10 to 15 minutes and then again continue to pinch. If the bleeding continues after 10 to 15 minutes, repeat holding pressure for another 10 to 15 minutes. Okay, or pinch the nostril for next 10 to 15 minutes. If re-bleeding occurs, blow out forcefully to clear the nose of blood clots. So blow out very forcefully so that the blood clots inside your nose must go out. If the bleeding lasts for more than 30 minutes or feel fainted, seek emergency care. Then do not pick or blow the nose and do not bend down for several hours after the bleeding episode. Okay, so after stopping this bleeding, do not blow the nose or do not bend for several hours. So these are the first aid that we must do when we have a nosebleed.
Hello! In this health sketch, we want to talk to you about CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. and try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the centre of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimetres. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it. So to recap, remember doctor's ABC. And if you have it, D. That's D for danger, R for response, S, shout for help, A for airway, B for breathing, C for circulation, and D for defibrillation. In this health sketch, we've shown you the simple steps you can take to help someone who has collapsed, is not breathing, or not breathing normally.
So, all of you watched a video on how to apply CPR. So, keep the process in your mind, and now you have a homework question. Prepare a chart on first aid and then display it in your room, in-house or classroom.
So, in this class, we have discussed the first aid for burn, snake bite and nose bleed. And you have watched a video on how to apply CPR. So, all of you carefully go through this, because first aid, the knowledge about first aid is very important because it can save a life sometimes. So, thank you and have a nice day.